So today we're going to talk about students with deafness and hearing loss. So the history of deaf education actually goes back fairly far in our history in comparison to other children with disabilities. We have Gallaudet coming into our country, having learned sign language, and establishing our first school for the deaf. And we actually still have segregated schools for the deaf in our country, as well as Gallaudet College. We have residential schools that sprang up, and we have instruction in sign language taking place. So the deaf culture becomes just what we're saying is a real culture involving interactions with other deaf people as well as a communication system. This remained the model for a whole century. And then we see also, but we also see the oral approach becoming popular later on. And there actually became a controversy over should we be trying to help students that are deaf to actually speak, or should sign language just be the main mode of communication. More options become available, though, again, later on in our history. So in terms of this sensory impairment, just like in the visual impairment, we have students who are partial in terms of their senses and then students that have a more complete sensory loss. If a child is hearing impaired, we say that that's an impairment in hearing, whether permanent or fluctuating, that adversely affects the child's education. Deafness is a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing, with or without amplification, and that adversely affects the child's educational performance. So again, there is a deaf culture. This refers to members of the deaf community who embrace deaf culture. The deaf culture identity includes being deaf, of course, using American Sign Language, and attending schools for the deaf. Deafness in the deaf culture is not considered a disability. What's the prevalence of hearing loss? And again, it depends on the definition used. We have professional organizations that provide definitions, as well as the Department of Education. So this particular professional organization indicates that approximately 1.5 of every 1,000 school children have a significant hearing loss. And so this is considered a low incidence disability. Our U.S. Department of Education agrees in that about 1.3% of all students receiving special education services under the Individuals with Disabilities Education Act have a hearing loss. What are some causes of hearing loss? Well, we have, again, just like every other disability, we have things that occur prior to the birth, so the child comes out already deaf, and that's problematic, because how do we measure deafness in an infant? We have acquired deafness occurring after birth. We have prelingual, occurs prior to speech and language development, and postlingual, occurs after speech and language development. So these are some terms that are used when we refer to hearing loss and deafness. Prelingual, obviously you can see that if the child's deafness occurs before speech is developed, the child's going to have much more difficulty utilizing speech and verbal communication, verbal language. So causes of hearing loss, prelingual, we have genetic disorders, prenatal infections, maternal illnesses, other conditions present at time of birth, and physical malformations of the ear. After birth or postlingual, we have meningitis can cause hearing loss or deafness, ear infections, certain medications, measles, encephalitis, and head injuries. There are 3 types of hearing loss that we look for. They're actually more audiologists and doctors that really deal with hearing. There's conductive or outer or middle ear problems, and if you have this, some type of amplification can help. There's sensory neural or inner ear or nerve problems, and mixed. There's some additional factors considered in hearing loss. Bilateral or unilateral hearing loss, so one or both ears. Fluctuating hearing loss could occur. And we look to measure hearing loss by decibels of hearing loss. So our hearing loss is measured in decibels. There's 7 classifications of hearing loss, ranging from normal hearing to moderate to profound hearing loss. And we know that actually loud noises, constant loud noises, can cause us to lose our hearing. So we can lose our hearing as we age and as we and if we're around more noise throughout our lives. But when we talk about children, hearing loss does affect their development. It affects certainly their ability to communicate. And children acquire language through communication. So prior to they're even entering a school setting, they have heard thousands and thousands and thousands of words. And so for deaf children, this becomes a problem in terms of their learning. Hearing loss reduces the quantity and quality of their learning experience. The characteristics of children with deafness and hearing loss: cognition may be impacted. So there are new nonverbal tests that indicate typical IQ distributions. So you can have children that are deaf or have a hearing loss with normal IQ, but many of them may suffer as a result of deafness in terms of their cognition. Academics, we know that delayed language development does adversely affect learning, especially learning to read and to write. Social emotionally, the children may be socially isolated because of their inability to communicate. And behaviorally, there's limited vocabulary because they haven't heard a lot of vocabulary potentially. So limited vocabulary of the emotional language. The assessments for this population include, of course, a hearing evaluation, general health, intelligence testing or IQ, achievement tests, and communication assessments. How do we determine eligibility for special education? If there's an inability to recognize most words and spoken conversation, a significant receptive or expressive delay in communication, an impairment of speech, articulation, voice, or fluency. So obviously these children will have a speech-language pathologist. They may also have a language interpreter. So we need to discover what's the preferred communication in both the family and the child. We have to consider the linguistic needs, the severity of their hearing loss, their academic level, and their social, emotional, and cultural needs. In early intervention, we're helping the family to understand the hearing loss and helping the infant learn to communicate as soon as possible and to interact socially, helping the baby to become a fully participating member of the family. At the elementary and secondary school levels, many of these children can be educated in a general education classroom, but they will need some supplementary instruction. Separate class sometimes are given for students who are deaf or hard of hearing, and sometimes there may be the choice to attend a separate school. Inclusion practices. Many students who are deaf or hard of hearing participate in regular ed. If they have an effective communication system, it's going to be essential. There is much debate about what the least restrictive environment is for a student who is deaf or hard of hearing. Again, it has to do with the deaf culture. When we're looking at transition into adulthood, there are many successful deaf and hard of hearing adults in almost every profession in our society. There's a high percentage of students who are deaf or hard of hearing that go on to post-secondary education. However, it's difficult, and we know that statistics show many have difficulty graduating. Underemployment of this population is a problem, so transition planning is extremely important. The recommended educational practices integrate vocabulary and concept development throughout. Experience is really important for these children, hands-on experiential learning. Visual teaching strategies is very important, and accommodations are needed. The perspective of parents and families, again, all families are different, so there's going to be a broad range of emotions, reactions, and challenges. The parents and families are going to need to understand the impact of the hearing loss, need to find appropriate services, and decisions regarding the home environment for the child. Recommendations for parents include that we have skilled and caring professionals working with parents, that we provide support, that there's early identification and intervention as soon as possible. There's involvement in experiential learning, extracurricular activities, and really placing a high emphasis on reading. The trends and issues in the deaf communication education. We are seeing more and more young children get cochlear implants. They are not without their difficulties, but we are noting that children are able to hear. There's universal newborn hearing screening, so we're beginning to be able to find out if younger and younger children have a deafness or hearing loss, and the need for bilingual and bicultural approaches for our ever-changing demographics of children who are not native English language speakers and don't come from English language speaking families. And that concludes Chapter 11.